The world of anesthesia might seem mysterious at first, but in today's episode of Optimal Anesthesia, we'll break it down and reveal ideas that really matter. The use of succinylcholine for precurarization is the subject of today's discussion. To assist you better understand this method, we will discuss the underlying process, the specific steps involved, and even present some examples from the actual world. Imagine this: you're in the operating room, about to administer succinylcholine, a powerful neuromuscular blocking agent, to your patient. You're well aware that succinylcholine can cause muscle contractions and sometimes lead to hyperkalemia, where potassium levels in the blood spike. This might sound daunting, but fret not, because we've got an intriguing solution: precurarization. So, what exactly is precurarization, and how can it make a difference in your practice? Precurarization is like the unsung hero of anesthesia. It's the technique where we use a specific type of medication before the primary muscle relaxant to minimize any potential complications and ensure a smoother, more comfortable experience for the patient. Here's the scoop on how it works. It all begins with a thorough evaluation of the patient's medical history and health. We're looking for signs that suggest that the muscle relaxant might cause problems for this specific patient. If we identify a patient who might be at higher risk of complications like hyperkalemia, severe muscle soreness from muscle fasciculation, it's time for step 2, medication selection. We choose a non-depolarizing muscle relaxant, often referred to as an NDNMB, with a rapid onset of action. Think of it as a muscle relaxant bodyguard. The common choices include rocuronium, vecuronium, atracurium, or cisatracurium. We administer a fraction of the standard intubating dose of the selected NDNMB. Here are the recommended doses for precurarization: rocuronium 0.3 to 0.6 mg/kg, vecuronium 0.03 to 0.04 mg/kg, atracurium 0.4 to 0.5 mg/kg, cisatracurium 0.15 to 0.2 mg/kg. We're not looking for complete paralysis here, just a partial blockade to minimize potential side effects. We keep a close eye on the patient for any signs of muscle weakness and track vital signs, like heart rate and blood pressure. This is our way of making sure that everything is going as planned and spotting any adverse reactions. We allow some time for that partial blockade to take effect, typically 3 to 5 minutes. Think of it as the calm before the storm. Administration of the primary muscle relaxant, typically succinylcholine. With precurarization in place, we can reduce the intensity of muscle contractions and the risk of complications. So, in a nutshell, precurarization is a technique that enhances patient safety and the overall anesthesia experience. It's like a well-rehearsed prelude that sets the stage for a smoother, more comfortable journey through surgery. Thanks for joining us on this episode of Optimal Anesthesia. Precurarization is one of those hidden gems in anesthesia, and now you're in the know. Stay tuned to our website for even simpler insights into the world of anesthesia. Until next time, signing off.